Hello, once again, everyone. Welcome to our MRCOG 3 Made Easy. Now, this is the other teaching module. This is an frequently asked, that is WHO Labor Care Guide. So, here, this is a simulated learner task assessing the following skills: the patient safety, applied clinical knowledge, communication with the colleagues. And you're an ST5, you will meet your junior trainee, Jack, with WHO partogram. You have 10 minutes in which you should outline WHO recommendations on intrapartum care for a positive childbirth experience, and also you need to explain WHO Labor Care Guide, the next generation cartograph. So now, just let me tell you a few, after giving an introduction, brief introduction, then I will move on to the station. So here you need to know, because this is a revised new one, so you need to know, of course it is introduced in 2020. So the WHO Labor Care Guide is launched in 2020, and so it is a revised partograph. It is a revised partograph, and partograph was introduced in 1970, for your knowledge. And so that is focusing. The main idea is it focuses on this new one, this WHO Labor Care Guide, but the may focusing on supportive care, maternal and fetal well-being, and shared decision making. These are the things important in the latest one, that is the recent WHO Labor Care Guide. And it is designed to improve maternal and fetal outcome during labor. And it is a tool for monitoring labor, and is developed. So it is developed by WHO as a part of the guideline on intrapartum care. So what are the advantages? Why we are so bothered about this WHO Labor Care Guide? It can reduce rate of cesarean sections and unnecessary labor augmentation. So now, what are the aims of this guideline, or the Labor Care Guide, WHO Labor Care Guide? The aims being it is a tool for implementing the recommendations on intrapartum care for a positive childbirth experience for the woman. And also the other thing is it is the next generation partograph. Aims at improving the quality of intrapartum care with ultimate goal of improving maternal, fetal and newborn outcomes. It includes the onset of active labor. It continues into the intrapartum, and also it includes immediate postnatal period also. So then the other thing, what are the other aims and objectives? The third thing is it includes monitoring and documentation. It is documentation. It is a document. So it includes monitoring and documentation of well-being of the woman and the babies, and also the progress of labor. Then it is to guide the skilled health personnel to offer supportive care throughout the labor to ensure positive childbirth experience. It also is the objective is to assist skilled health personnel to promptly identify and then address any emerging labor complications, and by providing reference thresholds for labor observations that are intended to trigger specific action if an abnormal observation is identified. So these are the aims, and also to prevent unnecessary interventions in the labor without any medical indication. And also, finally, it is to support the audit and quality improvement of labor management. So these are our aims. And the one thing we need to remember, the labor and childbirth should be individualized and woman-centered. So with this brief introduction, we will move on to the station. So now I'll start with, I already told you in the previous what are the things you should take care of in a teaching station, what things you need to take care of, the introduction, everything I have explained. So now, hello, here no doctor. Hello, I'm Manjula, one of the registrars in the labor ward. Then he will say, I'm Jack, Stephen. Though this is an introduction. So now you have to build rapport. Nice meeting you, Jack. How are you doing? How are you doing like this? So just establishing the rap. I see that you have recently joined our department, isn't it? Yes, Manjula. So how is everything in the department? Is everyone supportive? That means you're ruling out bullying. Then third thing is, now that is over. Introduction is over. Bullying is over. Now, how can I help you? That is what he want to know. Why he has come to you. So how can I help you? Then he will say, I would like to learn about WHO Labor Care Guide, Manjula. Sure. Then you say, sure, I shall explain about it. It's nice to know that you want to learn about it. That is the labor care, WHO Labor Care Guide. May I know the specific reason why you want to learn? So you want to know the reason. Then do you have any idea about it? So you're testing the background knowledge. Do you have any idea about it? He says, no, I don't have much, but I'm seeing every woman in labor. I'm seeing this labor care guide, and so I really want to know. Well, I shall explain. That's nice to know that you have interest to learn, and I shall explain about WHO labor care guide. Anything you want, anytime during my explanation, anything you are not able to follow, you can always interrupt me. So if you have any doubt, you can ask me questions. Will that be fine? Yes. Now at the end, I shall give some reading material. After our discussion is over, I shall give you some reading material and also about some strategy videos to know more about it, about the WHO labor care guide, and also you need to know the hospital policy also. So then after that, I will take the feedback from you about my teaching. And so will that be fine? Yes. Now, anytime you can come back to me with so that we can sit down and discuss about more of labor care guides, so that you can improve your knowledge. So now let us move on to let me explain to you. So now about the partogram, let me tell you, it is globally adopted. It is to assess labor progress, and it is used to assess labor progress, Jack, and also the well-being of the mother and the baby. That is the well-being of the woman and the baby for their positive childbirth experience. So now it is recommended by WHO. Previously, the old one was the partogram. The previous partogram was introduced in 1990, but 1970. But now the latest one is they modified. They have the next generation partogram is called WHO Labor Care Guide, introduced in 2020. So let me tell you, Jack, the aim of this is to improve quality of essential intrapartum care with ultimate goal of improving maternal, fetal, and newborn outcome. So it includes the active from the labor onset, that's active stage of labor, intrapartum. It continues through the intrapartum and postnatal period for the health of the woman and the babies. So am I clear? Am I clear? So Jack, now. Yes, I'm clear. So now let me tell you, with this introduction, now let me tell you about the WHO Labor Care Guide indications, when it should be initiated, when we are going to start, where it should be used, and what is the structure of the Labor Care Guide, what are the differences between the previous partogram and the present Labor Care Guide, and what has changed, what has not changed. So am I clear? Yes. Now with this, let me move on to. So now this first, what are the indications? So where do we use this? So it includes because it is indication is it is for the assessment and observation essential, which is essential for the care of all pregnant women. It is used in all pregnant women in labor, regardless of their risk factors. Primarily, it is designed for care of low risk women, and high risk women also may also we do this, but they need more additional and specialized monitoring and care. So am I clear? Jack? Now so can you tell me, Jack, when is it in which woman it is used? What are the indications? Yes, it is used in all women, all pregnant women in labor. When they come in labor, it is used. Yes, very good. So now, when should the labor care guide be initiated? So now let me tell you. So the labor care guide should be initiated when the woman enters the active phase of first stage. Labor, when she is 5 centimeters or more of cervical dilatation, regardless of her parity and regardless of her membrane status. And also, once it is initiated, it is continued into until delivery. That is, it includes the second stage of labor too. So am I clear? Yes. Now, where should the labor care? We need to know where it should be used. that is which places. So it is used at all levels of care in healthcare, at all levels of healthcare, and also because it will facilitate early identification of potential complications and hence timely referral when required. So, so it is used at all levels of healthcare. So now, Jack, let me tell you the structure. The other thing what we know is what is a structure. See, this is a labor care guide chart which we have. Labor care guide. This is the this thing we have in front of us. Let me tell you step by step. So now it has got 7 sections. So you have to take. For you need to show the student with this labor chart in labor care guide in front of you. So it has got 7 sections. It is adapted from the previous partogram design. The Section 1 is contains patient information and also the labor characteristics. So at the time of admission, the Section 1 is what we fill up. This is the documentation of the patient details, woman's details, her name, age, her NHS number, then parity, her parity is parity, and also you need to know about the labor date. This is her name, age, and NHS number, parity. Now, you have to take the labor characteristics also. The mode of labor onset, whether it's spontaneous labor or it is induced labor. And so then, the other thing is the date and time of onset of active labor. Active labor, 5 centimeters and more. Then time, if suppose the membrane rupture, she gives a history of membrane rupture, you have to note the date and time of rupture of membranes. And whether she has got any risk factors. So you need to know all these things in Section 1. Now we'll move on to the Section 2. Jack, this is the Section 2. So what do you see in only 2 or 3 questions you ask, that's all. So if you want to ask now, you can say what do you fill up in the Section 1? Then it is the patient demographics and also the labor characteristics. That is whether spontaneous or induced. Then very good, you say. Very good. You are very good. You are a quick learner. Then we'll move on to the Section 2. The Section 2 is supportive care. That is that supportive care here. This is the Section 2. It includes labor companionship. That is for emotional support, labor companionship. Then other thing is pain relief strategies. Then third thing is oral fluids. Fourth thing is we encourage women mobility during labor, and also the birth posture. It is according to her choice. So these are the things which are included in the Section 2. This is the supportive care. Now moving on to moving on to the Section 3. See, this is the Section 3 on this labor care guide. So that Section 3 is fetal monitoring. So we are seeing the fetal well-being by looking at the basal fetal heart rate, whether there are any decelerations, the amniotic fluid level index, and also fetal position. How is the fetal position, and molding, whether any molding, any caput. So these are the things we note in the fetal monitoring. Coming to the Section 4, this is the Section 4. Here, this is the maternal monitoring, where we monitor her blood pressure, pulse rate, temperature, urine protein, urine output, urine protein, and urine acetone. So these are the things which we should note down. That means yes or no, whether it's yes or no. Then coming to the Section 5, that is labor progress. This is about the labor progress. That is where we note down the frequency and duration of contractions in 10-minute period. And then when we do this vaginal examination, we need to be very gentle. We need to do gentle vaginal examination with her consent, and especially when the patient is uterus is relaxed, not when during contractions. So, and also we need to know the descent of the head. So cervical dilatation and descent of the head, we can first abdominally we need to palpate, then vaginally. So am I clear so far? Then moving on to Section 6, that is medication. This is the medication chart, where the medications, if they are used, we need to record it about the name of the medication, the dose, and the route. Suppose oxytocin is given, we need to know the oxytocin, whether it's given what units, how many units in per liter, or how many drops per minute. They are recorded every 60 minutes. Am I clear? Jack? Yes. Okay. Now we continue with the labor care guide. This is Section 7. moving on to the section 7, it is shared decision making. Shared decision making with the patient. So that is effective communication between the maternal health professional personnel and with the woman and her family, woman and her partner family also, woman in labor. So the communication should be there. So we need to explain to her about the procedure we may do. Suppose it is done about the procedure we are going to do, the purpose of the procedure, and after the procedure, the examination findings, or each examination, vaginal examination findings. Then subsequent course of action. All these things we have to explain to her. So we are taking the patient into a decision making. All these will will make her aware of the situation, what is going on. So it will reduce her anxiety. Now, how to use this? This is that is how to use this. So it is used in labor monitoring, and then so there are, that is we assess. It is in the 4 headings: assessment, record, check, and plan. So coming to the assessment, we assess the well-being of the woman and the baby and the progress of labor. That's one thing. Second thing, we record the document. We record, that is record. That is we document the events of labor observation. Third thing is check. We check the reference threshold values which are given, and we compare our labor observation to the reference values given in the alert column. Any deviation we have to note down. The fourth thing is coming to the plan. What is the plan? So we should know when we should intervene, when interventions are required. Always consult with the woman. So for example, in the planning, we may have to continue routine monitoring. That's one thing. Second thing, if any prescription of any, suppose we order for any diagnostic tests, we have to explain to her. So prescription of any diagnostic test. Third thing, arrange. Suppose augmentation, you want to augment the labor with oxytocin, you have to note it down, augment the labor with oxytocin. And suppose you are going to do any procedure like artificial rupture of membranes, or suppose you are going to do assisted vaginal birth or cesarean section, you need to note down and explain to the woman. So these are the things we have to do. Now, coming to the what has changed? What are the changes from the previous photograph and from present one, WHO Labor Care Guide? So Jack, let me tell you the similarities first. I will tell you the similarities, and then I'll tell you the changes, differences between the previous and present one. So am I clear so far about the indications, everything? Yes. Now coming to the what things which are not changed, the fundamental and the characteristic of the original Philpott chart, which was a graphical representation of the progress of labor in terms of women with cervical dilatation and descent of the fetal presenting part against a fixed time. It is retained. So this was there in the previous one, photograph, and also now also. It retains its key position in the labor care guide. That is the graphical representation of the progress of labor in terms of cervical dilatation and descent of the presenting part against time. The other thing which has not changed is formal regular recording of the important clinical parameters describing the duration and frequency of the uterine activity. The third thing is well-being of the woman and well-being of the baby. So these are remaining the same. These are the things which remain the same between previous photograph, and now the present labor care guide. So am I clear? Yes. Now, then what are the changes? What changes are there now, Manjula, like between previous and present one? Yes, Jack, I'm going to tell you about that only. Now, the differences between previous and present one are, see, 1 centimeter per hour, the alert line and its corresponding action line in the previous photograph have been replaced by evidence-based time limits at each centimeter of cervical dilatation during active first stage of labor. So this is one thing which has changed. So then the starting point of active first stage of labor is the cervical dilatation 5 centimeter or more. But in previous one it was 4 centimeters or less and less. But now it is 5 centimeter. Then the other difference which is there between previous and present one is intensified monitoring in the second stage, which is included in the present one. But previously the second stage monitoring was not there. Then the other thing is it records about the contraction coming to the uterine contraction The present labor care guide records duration, frequency of the uterine contraction and not the strength. Strength is not included in this. It is removed, but it was there in the previous paragraph. Now, coming to the supportive use of supportive interventions, which was not there in the previously a paragraph. That is, the supportive interventions are included in the present labor care guide. That is to improve overall childbirth experience. Well, like what I explained to you already, that is companionship, pain relief options and strategies, oral fluid intake and posture, encouraging women's mobility, birthing position, all these is per her choice. So these are not there. These are not there in the previous one. Then anything. Sometimes any deviation is there from the previous one. If there is any deviation, then you have to highlight it and the corresponding response to be recorded. Suppose there is any deviation from the routine things going on, you have to record it and what you have done for that. So the response to be recorded by the healthcare providers, which is not there in the previous paragraph. Now that is the introduction of an alert column to highlight abnormal findings is very important in this present labor care guide. Now, moving on to the second stage inclusion. That second stage is included, monitoring through second stage. It was not there in the previous paragraph because because uterine activity and maternal expulsive efforts make a second stage of labor as critical time and reduce vigilance at this stage may lead to poor maternal and fetal outcome. So that is why second stage monitoring also is included. And any observation which is identified that is not consistent with good care of well-being, so we have to circle it. We have to circle it and document it in the clinical or supportive care. Okay. Now, in response, that is, we have to discuss also with the women. This we have to discuss with women and circle it and document it. And prompt and early recognition and action will be taken to improve quality of care, so that the woman and baby receives. So this is way. These are the differences between the previous paragraph and the WHO care guide. Am I clear so far? Yes. Now coming to the assessment section, the care given is recorded. Overall, that is in the plan section. When you come to at the end, when we plan this plan, the care plan formulated is discussed with the woman and documented. Always this labor shared decision is very important. That is the highlight of this. So labor care guide is not just a labor record. It is a contemporaneous monitoring and response tool that might be complete and retrospective. So, am I clear? Am I clear? Do you have any other doubt? No, I got it. It's clear, but I need to see some more labor charts. I need to practice. Yes. So, to conclude, let me tell, labor care guide encourages the best practice that includes the promotion of good quality and respectfulness and compassionate care for all women and their families. So now, anytime when you're free, you can come always here. We will study some more labor care guides, WHO labor care guides, and we'll discuss about it. And you can go through the labor care guides charts so that you will remember, and then you can see the outcome also. Once a woman delivers, you can see do the retrospectively also. You can check the labor care guide. So now, how did my discussion go? Yes, it's excellent. I have understood everything. And so this is, I already told you about the reading material and all. So you can go through as many reading material as possible. So now we'll meet next time, anytime. Thank you for your time, Jack.